The best way to handle recalls in your office has changed very dramatically recently, and so I think it warrants a short video here. Also, below the video in the descriptions, I put some links to some of the things that are in the video, including the PDF slides of the video. And the advantage of the PDF slides is the links in the slides are active. Also, they can act as some flow sheets in there for you. We've got so many patients trying to sneak out the back door. We spend a lot of money and a lot of time worrying about getting new patients in, and yet we let these other patients, existing patients, escape. You should go into your appointment book and then into lists and recalls. And if you put in the time up there, the date range for about 1 year, it gives you a measure of how many of these people are overdue for their recalls and do not have appointments. Sometimes this is kind of startling to look at, and we want to try and, again, get these patients back in the office. It starts with the verbal skills and the things that you and your staff say to patients. And if you don't believe that cleaning teeth is the single most important service you provide, then I think your patients are going to pick up on that. On the other hand, if you really embrace this and the whole staff says this to the patients, it really helps get those patients back in the practice and have them appreciate the value of what you're doing for them. What I'm going to talk about here is the web scheduling for recalls, which is part of the eServices from Open Dental. Now, the eServices bundle, which includes a lot of things besides the web scheduling for recalls, is $165 a month. If I had to pick the one best feature in Open Dental, I would say it's the web scheduling for recalls. It's that powerful. So let me show you kind of how this works. You go into eServices, click on the recall, and you get this window. You want to go over there to number 4 where you're going to do the recall setup, and you can set up your messages, the frequencies with which patients get them, and so forth. So the eServices web scheduling for recalls is a lot like the Make Recall that you already have in Open Dental. And if you're not using this, you really should. This is the Hygienist BFF here for scheduling appointments. There's a video link down there. It's an older video, and it covers some of the same material in this video. But Make Recall allows you to very quickly and accurately make patient appointments. It puts the procedures that are going to be due in there and so forth. And the eServices web scheduling recall works in a very similar manner. With the web scheduling for recalls, when the patients do, they automatically get a text and or an email with a link they can click on to schedule their own appointments. Now, I've kind of hijacked this for Invisalign for my own purposes, but yours would normally say your cleaning appointment or whatever verbiage you have in there. The patient is then offered several dates where you have openings in the schedule, and this is entirely set up by you however you want to do it. But it allows the patient to schedule their own appointments 24/7. So then they say, I want the 22nd. It shows the dates that are available on that date. They then get a confirmation, say, you sure you want to do this? Yep, you're all booked. And this really, really works. Here are 20 patients that booked in half a day when they signed up for the web scheduling for recall. That's a pretty good return on investment. Now, obviously, you're not going to get 20 patients that book every single day, but you'll get a lot of them. And these are people that have not responded to your previous recall efforts. The nice thing about this is there's no change and no work on the part of the staff. They don't have to learn anything new. They don't have to do anything out of the ordinary. It just works. It's all automatic. So there's no telephoning, no texting, no time wasted, no staff time wasted, no training. Basically, there's just no excuses not to do this. It is so effective. So the way we suggest you set this up is have Open Dental send out automatically 4 different reminders to the patients. And this is just running in the background. Again, staff doesn't have to do anything any differently. Okay, well, we still have a job for staff to do for what I refer to as orphan patients. These are patients where you don't have emails or cell phones in there, and so Open Dental can't reach them. We still need to send regular old postcards to them, and that's very easy to do with this system. So you got a little work for a staff person to do, but not very much. How about when people don't respond? You send out the 4 different emails or texts and they didn't respond, then what are you going to do? They will pop back up on your recall list here. And then you can go in and say, you know, that's really a good patient. I'd like to get that patient back in the office. And you right mouse click and go to the account. And then you click on your letters. And we have a letter referred to as a dusty chart letter. And I think the link will be in the video there. And it just asks the patient, say, hey, we blew some dust off old charts and yours was in there. What do you want to do? So you can obviously edit this, but this works fairly well. You want to send this letter with a return envelope because you're asking the patient to respond down there. And maybe the patient moved away or whatever. Or maybe they want you to call them. So this is the last follow-up. And after this, we don't recommend you bug the patients anymore. So it all started with the right verbal skills to motivate the patients to keep their recall appointments. But after that, it's just totally automated, and this just works so well. So if you found this video helpful, give it a like and subscribe and hit the bell icon so you get notified about new videos. And you might also share this with some of your friends. So good luck. Try the web scheduling for recall. It is extremely effective. If you'd like some help with this, that's what we do.